Hi, I'm Julia Annext. I'm the director of the Kelly O'Leary Center for Autism Spectrum Disorders at Cincinnati Children's. I'm going to be talking to you today about a research study called Characteristics of Treatment Decisions to Address Challenging Behaviors in Children with Autism Spectrum Disorder, or ASD. Children with ASD are at risk for experiencing a range of behavioral difficulties such as sleep problems, ADHD, aggressive behavior, and mood problems. Parents of children with ASD face complicated decisions about how best to manage their children's challenging behaviors. Many behaviors could be improved with the use of medication. However, there is wide practice variation nationally and sparse evidence to support the use of medication, with oftentimes no clear best choice answer about which behaviors to treat first and which medications to use to treat those behaviors. This breadth of choices could be confusing and overwhelming, and this creates an excellent opportunity for shared decision-making, in which parents are allowed to share their personal views and preferences, and clinicians give evidence-based information to families to ensure that the treatment plan is most aligned with what's important to the family. There were 3 objectives for this study. The first was to describe the types of challenging behaviors that parents of children with ASD prioritize for treatment during their developmental behavioral pediatric or DBP clinic visits. The second was to describe the degree to which shared decision-making occurs during visits between parents and clinicians. And the third was to describe the extent to which parents receive a treatment plan that addresses their priorities and experience low levels of uncertainty about the treatment plan. We conducted a longitudinal cohort study enrolling children 4 to 15 years old and their parents who were scheduled to see one of 11 enrolled providers in our study, including developmental behavioral pediatricians and advanced practice nurses in a specialty developmental behavioral pediatric clinic. Parents completed validated measures before the visit and also consented to have their visit video recorded. Parents reported on their treatment priorities, indicating their overall biggest behavior concern for their child and their priority to treat during the visit that day. The visit was video recorded and scored using the options scale to assess for the level of shared decision making. After the visit, charts were reviewed to assess whether the parent's identified behavioral priority was addressed in the treatment plan of the visit note and documented in the chart. Finally, before and after the visit, parents rated their level of uncertainty about the treatment plan using the decisional conflict scale. Our study had some very interesting findings. We found, as expected, that challenging behaviors are common in children with ASD, but that sometimes the parent's overall biggest concern for their child's behavior is not necessarily their priority for the visit on that day. We also found that levels of shared decision-making were unfortunately low during usual care developmental pediatric visits. Parents left visits with a treatment plan that addressed their primary priority 65% of the time. Parents often felt uncertain about treatment decisions. Prior to a visit, 69% of parents reported clinically significantly elevated levels of uncertainty about the treatment plan. And while this significantly decreased after the visit, at the end of the visit, 46% of parents reported uncertainty about the treatment plan. This indicates that there's definitely room for improvement in better addressing parents' priorities and reducing uncertainty during developmental behavioral pediatric clinic visits. Shared decision-making interventions, such as decision aids, which can assess parents' preferences and priorities before the visit and can provide evidence-based information during the visit, hold promise for improving the quality of care for children with ASD in DBP clinic settings.